Good afternoon. I'm Sayukta from Radiance with You YouTube channel, and I'm sure all of you must be keeping good health. Today, we are talking about something that affects everyone, no matter where you live: fungal infections. We are going to have an important chat about them and how we can stop them from spreading by taking action early. Fungal infections like athlete's foot or nail fungus might not be the first thing we think about when it comes to health, but they are important and can cause serious problems if we ignore. They can make us really sick if we don't deal with them properly. But don't worry, we are not just here to talk about the problem, we are here to talk about what we can do about it. We'll look at how to stop fungal infections from happening and talk about the latest treatments as well. This month is all about being aware of fungal infections and how to stay healthy. So let's connect today with our skin expert. We have Dr. Devendra Deepchand Jain with us live from Mumbai to provide us vital information on advocating for prevention methods to combat fungal infections. Dr. Devendra Deepchand Jain is a senior consultant at Pratham Skin and Hair Care Center, Virar West, and Transform 360 Vasai West. Dr. Devendra Deepchand Jain has 28 plus years of experience. A very warm welcome to you, Doctor. It's such a
Thank,
pleasure to host you today.
thank you. Namaste, pranam, and good afternoon.
So डॉक्टर आज टुडे वी आर गोइंग टू टॉक अबाउट फंगल इन्फेक्शंस और जब गर्मी का मौसम होता है तो बहुत पसीना होता है फंगल इन्फेक्शन के केसेस बढ़ जाते हैं गर्मी के बाद मॉनसून भी धीरे धीरे आने वाला है और ऐसे में वहां क्योंकि गर्मी के साथ साथ ह्यूमिडिटी भी बढ़ जाती है फंगल इन्फेक्शन के केसेस बढ़ जाते हैं तो इसलिए बहुत जरूरी है कि हम समझें कि फंगल इन्फेक्शन क्या है किस तरह से बच सकते हैं और अगर हो गया है तो ट्रीटमेंट ऑप्शंस क्या अवेलेबल है तो स्टार्ट विद डॉक्टर व्हाट इज फंगल इन्फेक्शन
Basically, fungal infection is common in tropical climate where there is a lot of humidity and warmth. So, if you see the coastal area of India, it is there is a lot of humidity and warmth, and day by day, if you see over years, the temperature is going up, and because of that, there are these organisms which are saprophytes, means they live on dead skin. So they grow on your skin in the areas where the moisture gets trapped. So usually it occurs in, say, groin areas or underarms, or say in females below the breast, or between the toes in the uh, um, guys who wear the shoes for a very prolonged time, or those who are athletes, or those who are in armed forces and security. Uh, what do you call workforce. So there they have to wear the shoes and socks for a very long time, and they have to walk and stand, and that can lead to perspiration, and that gets accumulated between the toes. So these are the areas which are common areas where you can get fungal infection. Apart from that, it can happen in children, especially in the scalp also, and any part of the body you can have. But if it is happening on the exposed part of the body, mostly it is transmitted, means it is contacted from somewhere else, because on the exposed part the moisture does not remain there.
Right.
So mostly it is in the intertriginous areas or areas where there is a moisture, and in housewives who are working too much with the water and they keep their hands for wet for prolonged time, there they can get the nails get infected, and around the nail also, on between the toes. Even those people who are wearing tight ring fingers, rings in the fingers.
Right.
So while bathing and all, that water and soap gets accumulated into the below the rings, and then
Right.
that can also lead to infection. So these are the areas where you get fungal infections, and they live on dead skin. So they are on the superficial layer of the skin, which is known as keratin, which is a protein which is present on the the uppermost part of the skin.
Okay, so all those areas where the folds, the joints where normally sweat accumulates, and those are really prone to have fungal infection. Uh, as you said, doctor, that these are the body parts, so we can say that from head to toe you can get fungal infection on any part of your body. But the most
Right.
important point is to understand how we can prevent it. So any prevention strategies to that you recommend?
Yes. So most important thing is you have to keep a good hygiene. Second thing is avoid accumulation of moisture. So your clothing should be according to the weather. Like you should avoid wearing very tight clothes or clothes we don't breathe, like wearing jeans or synthetic clothes like say polyester or silk and all those things. So try to wear loose and comfortable clothing. Try to wear clothes which breathe. So natural fabrics like cotton and linen, they are preferred. Once you perspire a lot, suppose if you get the opportunity at the first instance, you should change the clothes, especially those clothes which has gone wet because of the sweating, and change to the another cloth. Take bath after you suppose go for workout, or you have done some activity and that has got a lot of perspiration. Then take bath with cold water, dab dry yourself properly, and then wear the clothes. And there are other things like don't share the linens like towels and all. If you go to some say clubhouses or in gymnasium, don't walk there on barefoot because there are fungal spores which are there on the surfaces, so that you can
Okay.
bring it along with you. Keep the areas which try to which tend to accumulate moisture or sweat, keep them dry, so don't wear the clothes immediately, especially this is for females. Don't wear the clothes immediately after bath into the bathroom itself, because once you take bath, even if you wipe it properly, some dampness remains. So if you wear all the clothes immediately into the bathroom, the dampness will remain. So try to wear a bathrobe or a cotton gown, and after some time go to another room and then dry yourself properly, especially the body folds, and then wear all the clothes. And even the English toilets, the commodes, if they are wet, and somebody is carrying the fungal infection on their butt areas, and then that can be transmitted. So be careful about that. Even even washing clothes together, actually washing machine, so that is
Mm.
also a source of fungal infection. Because what happens, somebody in the family has, and the same clothes is washed together into the washing machine, so that can also contaminate the other clothes, and people who are wearing those clothes can get the fungal infection. And if anybody in the family gets the fungal infection, try to get it treated as early as possible, because it is contagious disease, especially in people who are in close contact, they stay together, and that is the issue. Yeah.
Right. So we need to take care of our personal hygiene and the preventive measures that just has been explained by our doctor. Doctor, are there specific population that are more prone to fungal infection?
Yeah, those people who are elderly, people who are bedridden, people who are diabetic, especially because their
Mhm.
immune system is down. Uh, Athletes, those people uh, who wear food, this shoes for prolonged time. Uh, People who go for swimming, those who do gymming, and they go to gymnasium, and actually a population which stays in a coastal area and in the environment of hot and humid. Now if you see in Mumbai and this Konkan and this coastal area, throughout the year it is hot and humid. I mean, there
Right.
is nothing like there is some cold season in Mumbai nowadays. So these are the predisposing factors for, especially housewife also. They are doing their household chores and their hands are wet for prolonged time. Continuously they are dipping their hands into, and they don't try to wipe them dry, they keep it wet only. So
Right.
even they go to bathroom and for some work, and their legs are wet, so they don't try to make it dry, especially the interdigital areas, the areas between the fingers or the toes, that
Mm.
suppose some people they have the fingers very closely, especially the toes, the last
Right.
two toes are very
Mm.
closely approximated to each other. So there
Right.
the web space is not open to the environment, so there is no wind there going, so that they can become dry. So you have to purposely taking the effort and dry that area by wiping it dry. So these are small things which you should take care. And these are the populations which even HIV infected patients, by any reason, their immunity is down. Some
Right.
chronic diseases like chronic renal failure, patient who are of cancer and they are on treatment for that. So their immune system is down, so they are prone for fungal infections.
Okay, doctor. Doctor, can you provide guidance on how to recognize early signs and symptoms of fungal infection, enabling early intervention and prevention of the complications?
Yeah, so early sign is basically what you have to do is the fungal infection always causes itching. Okay.
Mm.
So itching is the predominant thing which disturbs the patient. So itching is one. Second is you have to see if there is a, actually it is also called as ringworm in layman's term. Okay. So
Mm.
the shape of the lesion is like a ring. It keeps on increasing at one border, you know. So it's a has sarsinate border and it increases. The central part may become clearer and it gets advanced along with that. So as soon as, and the areas which I mentioned earlier, which are prone. So in that area, if you are getting this type of symptoms and signs,
Mm.
then you should be bothered and immediately take care, means take help of a proper physician, especially dermatologist, to treat it early. Because what happens most of the times, people they tend to ignore because they think it is a minor thing, and then they try
Mm.
to self treat itself. So that is very dangerous, because once you start the self treatment, you go to a chemist and buy some cream for fungal
Topical
infection.
application.
Yeah, and these most of these topical applications which are provided by the chemist over the counter, they contain steroids. So now what
Mm.
happens with steroids is temporarily you will get relief for the itching. So your
Mm.
symptoms have subsided. But what happens, the infection itself becomes more chronic. It becomes more, it goes down deeper in the skin. And then the treatment becomes more prolonged. It takes more time to completely cure it. And there are steroid abuse side effects also. If you keep on using those steroid containing cream for a longer time, the
Mm.
skin becomes affected there. The skin becomes thinner. It sometimes, develops means stretch marks, which are not reversible. Even if you stop the steroid, the stretch marks don't go. Many a
Okay.
times, the patient come to us and they have used these steroid containing creams for months together, and then the fungal infection is treated completely, though it takes longer time.
Mm.
But the stretch marks remains and they are worried about the stretch marks, but nothing much can be done once the stretch marks are there. It can be made improved, but then it cannot go completely. So these are the precautions. So only best thing is recognize it and go to a nearby qualified dermatologist and get it treated as early as possible, because the treatment time will be less and
Right.
uh, complications will be less. Yeah, the chances of spreading in your other family members will be less. We nowadays see,
Mm.
people, four people in a family, like, both the parents and two children, all are affected at the same time. So four people, they come to us and you have to treat. So it is a more financial burden. It is, again, the morbidity is there, embarrassment is there, scratching, on those areas when you are in public. So these are the issues.
Right. So the best thing to do is to, in case you have itching, in case you have rashes, even if you don't know whether it's fungal infection or anything else, please do not go to any chemist shop for any over-the-counter medication or home remedies or what the influencers on various social medias are asking you to do. Go to the right person, which is a qualified dermatologist. They will, diagnose, they will see, and then they will decide the line of treatment accordingly. Otherwise, you'll end up wasting money, wasting your energy, wasting your time, and most importantly, risking your health. So don't do that. Go to the right person at the very right time. Another way, common thing that we have notices with fungal infections are that they reoccur. So why this recurrence is there, doctor? What to do about it?
See, the recurrence has, you have to find out the cause. One is compliance. If compliance means, suppose the patient has been given the treatment, but the patient does not complete the treatment according to the suggestion by the
Hmm.
treating physician.
Mm.
So what they do once the symptoms disappears, like itching, in this case, the most important symptom is itching.
Right.
So symptoms disappear, itching disappears. They think my disease has been cured, but it is not like that. Over a period of time, what has happened, the fungi in India at least has become very, very, you can say, resistant to the treatment.
Mm.
They have become more virulent. So earlier, shorter duration of treatment, smaller doses also used to cure the
Right.
fungal infections.
Right.
But nowadays, over a period of years, the fungi, they have become more virulent, so they cause more severe disease, more resistant to treatment. So you have to give higher doses of the same medicine, and you have to give for longer time. So you
Mm.
have to follow the instructions, and till your treating physician tells you to stop the treatment, you should not stop the treatment. That is very important, because the fungi, they remain on the body. Even your itching has gone. So those remaining fungi, when they get the favorable environment after some time, and obviously the treatment has been stopped, the recurrence will be there. That is one. Second, if there is somebody in the family has been affected, and you
Mm.
go and treat yourself only, and the family members is not been treated, since it is a contagious disease, you can acquire it again from your family member. That is
Right.
second thing. Third, if your diabetes or other immunosuppressive conditions are there, like suppose very common in female is anemia, that is the hemoglobin level is low. So that also lowers your immune system. So in such cases, also the diabetic, lower immune system, lower hemoglobin, thyroid patients, patients who are on anti-cancer treatment, patient of chronic renal failure or any debilitating conditions where immunity is low, older people. So there, the chances of recurrence is more. But if you follow the instructions properly, take all the measures which we have discussed to prevent fungal infection, complete the course of treatment, then the chances of recurrence is less.
Right. So it becomes even more important to go and contact and seek advice from a doctor, because otherwise, A, you'll end up worsening your condition by doing self-treatment, applying topical applications, etc. B, there are also chances that you'll get resistant, and the treatment won't work on you. And a very related question to this again, doctor, we have talked about how we are, blindly applying topical creams taken from a chemist shop. And then there are people who go and take antibiotics, antifungal, medication, pills, and they'll keep on having them whenever they'll feel that they are having any kind of infection. So again, that also make them more resistant towards any other
Yes, yes.
treatment.
See, any oral medication, especially antibiotics and antifungal, has to be taken in proper doses and for proper duration.
Mm.
If you take for a few days in a suboptimal dose, then what happens? The organisms to which uh, these drugs are effective slowly will become resistant, because they are exposed to suboptimum doses. Since you have not completed the course, since you have taken lesser dose than recommended, so they become resistant, then those medications are not going to work on you. So
Mm.
you have to be very, very cautious about first self medication, especially antibiotics, oral antibiotics and oral antifungals. You should not take like any other pills, like you take paracetamol when you get fever. So
Mm.
resist from doing that. So you are not harming yourself in the future, but you are harming overall the whole population, because the fungi in general will become resistance. It will be
Right.
like a herd immunity. So
Mhm.
like we give vaccination to eradicate one disease, so we create herd immunity by vaccinating the whole population. So
Yes.
similarly, if there are many people taking these type of medications, um, interrupted, and they are interrupting taking by their own low doses, suboptimum doses, does not complete the course, then there are chances of developing resistant strains all over. So you are
Mm.
risking yourself, and you are risking the other people also in the population. So you should resist from that. It's a total no, no, no.
Absolutely, but in our society, the irony is that over-the-counter medication is so easily accessible, available, and we fall prey to it. But yeah, we should resist from doing it. Now, doctor, when a person with fungal infection comes to you, or say any other infection, because the person is not sure what kind of infection it is, they come to you. How do you diagnose? It's just by physical or clinical examination, you can say, or there are tests to confirm.
99% it is clinical examination and the history,
Okay.
because it's a very obvious case, and obviously a dermatologist you know is been trained to diagnose things.
Right.
So most of the times it is diagnosed clinically. Hardly it requires some tests, and one test which we do, especially if the child is affected by fungal infection of the scalp, then we
Mhm.
do a Woods lamp examination, which is a in clinic examination. So you expose the scalp to ultraviolet light, so particular nanometer, around 311 to 313 nanometer light, so that
Mhm.
the fluorescence is there. So if there is fungal infection, then there will be greenish blue fluorescence, yellowish green fluorescence. So by that, or sometime even reddish, you can say coral red fluorescence. Okay,
Mhm.
so that can be diagnosed. It has to be done in a darker room, perfect dark room. Okay, so that is one. Second thing is taking a scrape. You know, so you take a scraping of the involved area and do a KOH mount, potassium hydroxide mount, on a microscope. You can see, and that will show the fungi, hyphae, and spores. I mean, the organisms will be seen. It can be done by the dermatologist if he has the facility, or it can be done by a microbiologist nearby. Okay. Nail involvement may sometimes you need. So you do a nail clipping and dissolve it into KOH and again do KOH mount. So these are the common small investigations are needed. Very rarely, especially for the for the research purpose and in institution, they do fungal cultures. Okay, and that is to see the resistance level of the fungi, means which medication or oral fungal antifungal is effective in that particular patient. Or if suppose a patient is given a full course, the patient has taken it properly, the compliance is proper, and the patient has not responded as it should be, then you go for fungal culture. But the problem with fungal culture is most of the times it is not standardized. Not many labs are equipped to do fungal infections, fungal culture, sorry. And it takes a lot of time, to grow the fungi. So you don't get the result very early. And meantime, what you should do, you are stuck, means you have to, with your clinical judgment only, treat the patient. And regarding one point I just missed when you said which population is at risk. So another thing, obesity is another cause. People who are overweight and obese, there the body fold and sweating is more. Usually, obese and overweight people, they sweat more compared to the normal population, and they have body folds which are more prone to have the sweat accumulated there, and they are more prone for fungal infection. Yeah.
Okay. And once you have diagnosed, clinically or if required through any test that it is a fungal infection, then what are the treatment options available, doctor?
See, treatment usually is one is symptom relief immediately. That is most important, which is concerning to the patient. And so that is antihistamines. Usually we give for symptom relief till the itching is there. Second is topical medication. So there are a lot of antifungal agents are available, older agents, newer agents, which can be effective. And that has to be applied once or twice a day according to the molecule the doctor chooses. The only thing is those cream should be applied on the affected area and 2-3 inches beyond the margins of the area. So that is very important.
Okay.
Okay, so it has to be applied 2 to 3 inches up beyond the margins. And there are oral antifungals. Now again, history taking is important. If the patient has came to me directly, means is a naive case, he has not used any medication, and the infection is limited to
Hmm.
one part of the body, then I may just give only topical antifungal. There is no need to give any oral antifungals. Okay. But suppose the patient is having multiple part of the body involved, means it is an extensive lesion. Patient has already used something previously before coming to me. Then we may have to use oral antifungals, and there are two, three molecules which are available in the market. Like terbinafine is there, fluconazole is there, and itraconazole is there. But nowadays, most of the fungi, they are susceptible. Means only itraconazole oral is effective in the treatment. Like earlier, when we were students, or few years, say 1 decade below, we used to treat with oral fluconazole also. Even terbinafine was effective, but nowadays we see not very good results with those molecules. Yeah.
Okay. Doctor, if a pregnant lady or a lactating mother is infected by fungal infection they are having, then how do you decide the line of treatment in case of a pregnant lady or lactating mother?
These are special circumstances, especially actually. So if the pregnancy is in the first say first trimester of the, means first 3 months of pregnancy, then we
Mhm.
try to avoid using any oral medication, and we use only topical as far as possible. Uh, there are azole derivatives which are available, like maconazole, then clotrimazole, then ketoconazole. These are the drugs which can be applied only topically to the affected area. Then you can give even some washes, salicylic acid containing washes, which are basically keratolytics. Now, I told you, fungi are actually saprophytes. They live on dead skin. So they
Mhm.
are only on the superficial skin. So by any means, when you use salicylic acid washes, which are keratolytics, means they remove the superficial layer of the skin, the dead skin, then the majority of the fungi are washed away with that. So try to limit the medication to the topicals as far as possible in the first trimester. Second and third trimester, if the patient has come to you and the lesions are really very extensive, again here, if the lesions are limited, then only try to give topical and manage it. If their lesions are very extensive, only topicals you cannot manage, then oral terbinafine is recommended, can be given, but you have to counsel the patient and explain them. In lactation, you can use itraconazole, because itraconazole can be given in children also. Uh, lactating females can take itraconazole if needed. Again, I tell you, oral antifungals should be given only if it is indicated, if the lesions are very extensive, or the patient has already been treated by themselves or somebody else and it has not responded, then only you give oral. If it is a limited area involving only one part of the body, then treat it with topical in lactating and pregnant women.
Okay. And doctor, now we would like you to shed some more light over nail infection and scalp infection.
Yeah. So as I said earlier, scalp infection is more common in children. In adults, you don't see much of scalp involvement by fungi, but nowadays we do see, because of this rampant, uh, what do you call that, involvement of fungi, the superficial fungal infections in the society, and use of all these steroid containing topicals by the people. uh, the infection has become more severe, and even adults do get involvement of the scalp, though it is rare. In children it is more common. So there also the treatment remains the same: oral antifungal, topical. But in scalp, you prefer giving lotions rather than cream application, because lotion is more easy to use in the hairy area, and you can give antifungal shampoos to clean the hair, not to apply oil. And this is for the scalp. For nail infection, usually I told you, the housewives who uh, are involved into housework, and they are keeping their hands wet for prolonged time, they are more prone for nail fungal infections of the hands. And those people who are wearing shoes and socks for a very longer period of time, those who are in say security job, they are more prone, or athletes, they are more prone to get toenail infections. So there, the duration of treatment is little longer, because nail is the end part of the body. Nail is a dead tissue. So anything applied on the nail is not going to get absorbed. Okay. So whatever you are going to give is taking oral, and that, get absorbed from your digestive system, from your gut. It gets into the bloodstream and it reaches the site of infection. Now imagine the nails, even the fingernails and the toenails, both are last part of our body. So how much blood supply is reaching there? Very less. So that much drug is going to reach there. Okay. So the time taken to eradicate the nail fungal infection is longer compared to when the skin is involved. So that is very important, and you have to complete the course till the nail becomes normal. Because even the little amount of infection remains, and you stop the treatment, that is again going to get worsen over a period of time if they get a favorable condition. Okay. And whatever solution we usually give topically, that should be applied around the nail, at the nail and the skin junction, rather than on the nail, because as I said, from the nail it is not absorbed. Okay. So it has to be put around the nail folds, uh, all the side. And there are certain nail liquors are available. Now these nail liquors are containing antifungal. So there are two molecules which are available. One molecule you have to apply it daily. It is like a nail polish. So on the affected nail, you can apply daily. From that preparation, uh, the drug is absorbed, and then it acts locally. And another preparation is there which has a prolonged time of action. So you can apply even once or twice in a week. So that is only topical application is given only when the nail is involved, only one nail is involved or two nail is involved, and very minor infection is there. If many nails are involved and the infection is very severe, then you have to give, along with topical, you have to give oral medications also.
There are so many questions by our viewers, but most of them are what we have discussed. But there is one question by Sachin. Which type of food we have to strictly avoid during fungal infection? Is there a relationship between diet or fungal infections, doctor?
Actually, food has no role in fungal infection. But as I said, obesity and overweight, these are the issues which can cause fungal infection or can make the fungal infection worse. So you try to have a healthy lifestyle, avoid weight gaining, and keep yourself, fit and lean as far as possible. So otherwise, any particular food does not have. Only food I can think of is any food which can make you more perspire.
Mm.
Okay.
Right.
So spicy food or something like that can
Mm.
make it. Otherwise, no, food has no role.
Okay. Now we have seen that, in case we get anything on our scalp specifically, even if it's a dandruff or a fungal infection, as a layman, we don't know what it is. The first thing we do is to apply some oil, and that's our best way to go for it. Only when it worsens is when we realize that this is not, what we were thinking about, and let's go and consult a doctor. Now, applying oil on our skin, on our scalp is a very common thing that we Indians do. Is it good or bad in case of a fungal infection? Because they have the same, thing. They'll itch. Oh, it's itching. There is a rash. Let's apply some coconut oil. Or in our scalp, we do the same. So, do they work?
In the scalp oil, if the scalp is dry, then little bit of coconut oil, because coconut oil is the only oil which acts as a emollient. Little bit emollient uh, activity is there, and it has been proven scientifically. They have studied coconut oil, but it should be applied for few hours before you shampoo. So don't keep the oil for say over for many hours, and don't apply oil after you shampoo the hairs. Okay. Ideally, oil, if you want to apply, should be applied on the shaft of the hair, like we apply conditioner before shampooing. So it is, we call it as a pre-shampoo conditioning of the hair, because the shampoo is meant to cleanse the scalp, but the shampoo is harmful for the hair shaft, means the length of the hair. Okay. So when you apply oil before shampooing on the shaft, on the length of the hair, you are coating it with the oil. so that the harmful effect of the shampoo does not affect the length of the hair. So that is the role of oil. And oil does not give you any nutrition to the hair. That is a big misnomer and misconception, because the oil does not get absorbed from the intact skin. So if you apply oil on the scalp or on the skin, it is not going to get absorbed and get give nutrition to the hair. So that is a misconception you should. Another thing is on the body. Uh, Again, I told you, oil is a little, especially coconut oil, is a little emollient. So if the skin is very irritated, uh, and especially what I do in my practice, if the patient has used steroid for a very long time, the skin barrier function has been affected. Uh, so the skin has become thin, it has been damaged, you know. So to repair that barrier function, because on damaged skin, if we give topical antifungal directly, you know, sometimes that also irritates the skin. And the what happens, the we know as a doctor ki it is going to irritate, but the patient uh, compliance go down. They feel ki I am applying the cream and I am feeling more irritation, burning, or you know, even itching. So they try to avoid applying. So what I do is, along with that, at night time, I ask them to apply a little bit of coconut oil to the affected area, so that that acts as an emollient and it repairs the uh, damaged barrier function of the skin. So this is the only role it has, and that is also for temporary, maybe for a few days to few weeks. That's all.
Right. So, and Doctor, before we sum up the whole session, any take home message for our viewers?
Yeah, take home message is, very important thing is, don't treat yourself. Okay. So any symptoms or any changes you see on your skin, consult a qualified dermatologist nearby you, because by, you know, you are not equipped to diagnose, neither your friends, neither your colleagues or family members. Even the chemist is going to give you something which is going to just make your symptoms less. That is, the itching may improve, but your disease is going to be worsen. It become more chronic. It will take more time. There may be complications in the sense the skin get damaged, which is irreversible damage, like creating striae and all those things. So that is very important to learn. Any changes on the skin, if you notice, try to take an opinion of a qualified dermatologist. No self medication, no home remedies, no treatment by any near and dear ones. That is very important.
Absolutely. Thank you so very much, Dr. Devendra Deepchand Jain. It was wonderful talking to you. Thank you for your valuable time in this very informative session. Thank you, sir.
Thank you and have a good day.
You too, sir. Have a good day. And viewers, thank you for your active participation in today's session. Stay connected to our channel. Do not forget to subscribe our channel, Radiance with You. Have a great day ahead. Goodbye.